Hi, Dave.
Joanna, how long do you want to wait?
I think we can go ahead and get started.
All right. Good evening. My name is George Glazer, and I am your host for this evening's presentation. It's entitled, there's always something. Yeah, let's try this again. Welcome to this program sponsored by the American Society of Clinical Hypnosis, entitled Hypnosis 101 for Practitioners and Patients, Putting the Body-Mind Connection to Work. This 90-minute webinar is being recorded, and the recording will be available later this week on the ASCH website and will be available for viewing there. For viewers who need ASCH CE credits, this program is eligible for 1.5 hours of ASCH continuing education credit. One housekeeping issue to note, as our speakers move through their presentation, please enter your questions using the Q&A button at the bottom of the Zoom screen. The Q&A will be monitored and your questions will be addressed at the appropriate time. If you need assistance, use the chat button and address your comment to Joanna, who is serving as technical producer and host. I am fortunate to serve as host of this webinar, featuring two wonderful friends of mine, Maryanna Polukhin and Mark Weisberg. I am very fond of these people, and you will have an opportunity during the next 90 minutes to discover much about their caring and extensive knowledge of the ways that our bodies and minds function as a whole. Working as a team, they will help us all understand important ideas about sensing and understanding people and persons as a unified being, and about how hypnosis can help patients and doctors work together even more effectively. I'm coming to you from Austin, Texas. Maryanna is broadcasting from West Hartford, Connecticut, and Mark Weisberg is lighting up the internet from his home in the Minneapolis area. Joanna is off screen and serving as our technical producer, and she's in Annapolis, Maryland. So we are spread far and wide here. Let me say a bit about our two presenters. Maryanna Polukhin, MD, will share her 20+ years of experience gained in practice as an internal medicine specialist. She is a staff physician at Starling Physicians Group in Newington, Connecticut. She views medical problems from a broad perspective and is continually searching for solutions using mind-body approaches. Dr. Polukhin realized early in her career that the mental and physical states of her patients are equally important. That realization led her to seek training and a certification in body-mind integrative medicine. Serendipitously, I met her as a result of her interest in learning clinical hypnosis as a tool to help patients achieve the goals of improving their physical and mental harmony. Dr. Mark Weisberg is a board-certified clinical health psychologist in Minneapolis. He is a fellow of the American Psychological Association, American Society of Clinical Hypnosis, and American Academy of Clinical Health Psychology. He has worked at the Minnesota Head and Neck Pain Clinic in St. Paul, Minnesota for several decades and maintains an independent practice in Minneapolis. Dr. Weisberg has been involved in clinical practice and consultation in integrative mind-body medicine and treatment of chronic physical conditions and teaches nationally and internationally on these topics. He has numerous publications in the medical, dental, and psychological scientific literature. He is the co-author of Trust Your Gut, Get Lasting Healing from IBS and Other Chronic Digestive Problems Without Drugs, a consumer book on integrative treatment of digestive disorders. I highly recommend you take a look at this book if you're having any issues like that. Many of you have likely become expert at setting up your screens on Zoom calls, but just in case, I recommend that you have your Zoom screen configuration set to side-by-side mode with speaker view. That way you can adjust the proportional size of the PowerPoint and speaker video panes. Without further ado, I'll welcome Drs. Weisberg and Polukhin. Enjoy.
Good evening. Thank you for being with us. It's really a wonderful opportunity for us to talk about something that is so important to our practices and also to our lives, and learning something that is going to hopefully open your eyes for those who have never talked about it or learned about it to something that is extraordinary. And I apologize for using the words of that power, but extraordinary it is. Extraordinary history, extraordinary results, extraordinary insight in our bodies and mind. So the learning objectives you see on the screen, and we'll try to cover it all, or I'm sure Mark will make sure that we do it very well. And I would let Mark take on.
So thanks, Maryanna. It's a pleasure to be with all of you this evening. It's my pleasure also to teach with Maryanna tonight for the first time. It's my pleasure to get to know her better, and we're hopeful that this will be useful for all of you. And just to note that you will have access to all the slides here. It's important for Maryanna and I that there be an accessible and usable flow of information this evening. So we may or may not get through all the slides in the presentation, but do know that if there's anything we don't cover this evening in the slides, you can feel free to contact us afterwards. And there's, at the end of the presentation, you'll see website addresses where you can reach us. And our goal for this evening is something that, at least in my experience with ASCH, is somewhat unique, which is we are reaching out both to consumers, people who might find benefit in experiencing clinical hypnosis for any number of different problems, but we're also speaking to health practitioners, and especially those who may not be familiar with hypnosis and might have some interest in their applications in physical and psychological and what I like to call psychophysiological conditions, which constitutes much of what we see in chronic conditions. So as George mentioned before, for any of you that have questions that come up as we go along, please enter them in the Q&A that George will see, and George will get our attention at various points along the way, and we'll respond to the questions at an appropriate time. So Maryanna, why don't you speak about these?
So the dream of the future, I would say that I share with Deepak Chopra about not only having the technology available to us, pharmacology, procedures, amazing doctors doing amazing procedures, but also each of us getting the tools of being able to understand what's going on in our bodies, to prepare ourselves for times when we need to be stronger, when we need to be more resilient, but also learn how to rest, how to be better, and actually look in the very depth of the most amazing pharmacology, factory that you can imagine, our own body, our immune system, our resilience, our mind that then create new connections, and how we can practice things that are better for us. I'm looking forward to being part of that in the future. And also, isn't that interesting how the new and the old, they all come together in a circle, right? Especially when something is so insightful, somebody is so insightful and brilliant as Dr. Osler has been before. And it is about a patient or a client, or each of us, really, any of us, physicians, therapists, psychologists, all of us, we all share humanity, and all of us want to be seen as a whole person, our whole story. What is it about us that makes us stronger and better? And that's why I think hypnosis is just one of the ways to achieve that, to see a person as a whole and also communicate and inspire changes in that person that are beneficial for their health, physical and mental. Oh, and this is to learn something, you have to create a weather for this. You have to create a state. And for that, I invite you to imagine you sitting in a magic chair, and it's a little hut where a special type of energy could be created. At least that's what I was told. Maybe it's true, maybe it's not. But we need a space where we can do a very important work of making new connection, and also a state of mind where you are absorbed new information and trying to work very hard. Remember, one of the hardest works that is going on in the body is what's going on in the brain. The connections, the new connections to be made, the new neurons, to extending the little fingers, first arms, and saying together something that becomes eventually a new pathway. So let's enjoy and learn something new.
So along that path, it'll be helpful to define some terms. You've heard us mention the body-mind connection, mind-body medicine, integrative medicine. Let's get on the same page about what we're talking about here with some of those terms. So what is different about an integrative medicine approach from a standard approach? And what do we mean by mind-body medicine? These terms are thrown around a lot, and I think they're often misunderstood. And I think especially as we discuss what is clinical hypnosis, it's important to think about this background. You know, typically when I'm teaching at conferences, and I ask the participants, who are mostly psychologists, physicians, dentists, social workers, nurses, call out names of a mind-body technique, and they'll say acupuncture, or Reiki, or healing touch, or herbs, or etc. And I'll say, how come nobody said surgery? How come nobody said physical therapy? How come nobody said medications? I think this is a big confusion, that we think of mind-body medicine being one type of treatment versus another. But I think, and Maryanna started to touch on this, we're really looking at an underlying orientation, which is of integrative medicine, which is that we all possess internal self-healing resources. And the goal of the healer is to help catalyze those resources in the patient. And I think it's important to keep this in mind as we start to talk about hypnosis, because one of the myths about hypnosis is that the doctor is doing something to the subject. And I prefer that you view it instead as we're creating an environment in which the individual can find something within themselves that they might not have known was available to them. And when you view it that way, the way you start to think about hypnosis begins to change. So what is the mind-body connection? You know, there's all types of ways in terms of this inherent wisdom, signals that our body lets us know if we're tired, if we're hungry, if we're upset, if we need rest, if we need activity, if we're willing to listen. The meaningful signals that we call feelings. And it's interesting too, let's see if I put this here, that the word feeling, if you stop and think about that for a moment, really has a double meaning. Feeling refers to sensation. I have feeling here on my hand, And feeling also speaks to emotion: happy, sad, scared, tired, excited. We, in our culture, tend to separate what's physical and what's psychological, but our brain doesn't. And it's important that part of the body-mind connection is that emotion, sensations, thoughts, physical impulses are all tied together. And part of the power of hypnosis is to be able to access all those levels of function simultaneously. Maryanna, do you want to take this part?
Yeah, I was just thinking about the typical day that I would have in the office. I have a very busy primary care office, and people come with all sorts of problems. Actually, primary care doctors probably see more mental health problems than psychologists or psychiatrists, because this is what people come with. And how many times they come to us with idea that they'll get help. And very interesting that sometimes, even if you don't do anything in the sense of prescribe a medication or give an injection or do a procedure, and in primary care, there are not too many procedures, to be honest. And the person says, I don't know why, but I just feels better. I just feel better. And it's not by, hey, I'm not telling them to feel better. But there's something that they experience in their mind that creates that, almost like they didn't do it on purpose, right? Because they could have felt better somewhere else, but they're ready for that. They're expecting to have a good positive experience before, so suddenly they are feeling better. So it is the connection of the body, how the body feels when the mind is in a good environment, accepting environment. So it is quite amazing what could be done, or you can just observe in our daily life. You don't need to have hypnosis for that. You just need to be prepared for something where the mind, the emotions, the feelings will go the path that is different and will make whatever is bothering you a little bit better. Does that make sense, Mark?
Of course, and I'm thinking, Maryanna, as you talk about this, part of what's so important in what you just described is that often what makes a patient feel better is the connection with the healer. There's something about that relationship that in itself is a very, very important ingredient. And we know that in meta-analyses of psychotherapy, looking at what are the variables that most strongly predict a successful outcome in the treatment of any type of condition, more than any particular technique, what always comes up as the #1 predictor of success is how the patient rates the quality of the therapeutic relationship. I'm mentioning this because as you think about hypnosis, the same things apply. We're going to talk about what hypnosis is, how it works, what happens in the brain, etc. But it's similar to other types of healing ventures in that the quality of that therapeutic relationship will still be one of the primary ingredients that will predict success in whatever it is that you're treating in the patient. Part of what we want to talk about is why is hypnosis important and what are some of the properties of human behavior and function that hypnosis gets at? So let me start to touch on that. One of these variables has to do with the notion of what is voluntary and what's involuntary. In traditional medicine, the conventional wisdom has been that you can change voluntary processes in the body. You can scratch an itch, you can choose to walk faster or slower, you can modulate the volume of your voice. Those are voluntary processes. But our thought has also been that we're unable to change involuntary processes. Until recently, you wouldn't have thought that, for example, you could accelerate the healing of a bone fracture, that you could slow your heart rate, or you could optimize the way that your immune system works. We now have really good scientific evidence that tells us that, in fact, we can do these things. This is one aspect of the power of clinical hypnosis, is to be able to access these levels of function as well. That you can use clinical hypnosis to help modulate processes in the body that before were considered involuntary. changing one's heart rate, modulating one's blood pressure, changes in immune response. I have a lot of interest in treating digestive disorders and have written about it. It's profound what can be done with clinical hypnosis to help people with all kinds of digestive problems, huge in the area of chronic pain treatment as well. We're going to talk a lot this evening as we go about body-mind practices. These are important because that will help these skills of modulating physical and psychological parameters to help them improve. Hypnosis is just one example of another mind-body practice that can strengthen these skills and make them more accessible, that you can enjoy and benefit from them if you're a patient, and you can use them to help your patients if you're a practitioner.
I just want to say that I remember first time, just a little anecdote from practice, when I just started learning hypnosis. I think it was after advanced, it was several times that I've gone to hypnosis training, and already was trying those waters. And a person that I know very well, actually working in my office, was getting ready for surgery. She had similar surgery before and was petrified, pain, suffering, complications. And I said, okay, you know what? I have never done this before for this particular, but I know what to do, how to do it. So let's do it. And she's like, okay, I trust you. Let's do it. And it felt, and again, I know what I was doing. I learned it. I was taught many times. I prepared, but still felt like a miracle because she was telling me, because I called her obviously right after the surgery, and she says, you know what, Maryanna, I did not have pain. I only took Tylenol once, and it feels so comfortable. And I feel so wonderful that I had gone through that procedure, and I have no suffering at all, and I feel that I'm healing great. So it's just something that I don't like to leave the magic outside while we're talking about science.
Yes, the magic is an important piece, and it's accessible magic, which makes it particularly exciting. So voluntary and involuntary, that's one aspect we're talking about. Another aspect to consider in regards to understanding hypnosis is what we call neuroplasticity. Many of you may be familiar with this term already, but it's important as it applies to hypnosis. Similarly, just like we believe that we couldn't change involuntary processes in the body, our belief, the common wisdom until just recently, is that the human brain is fully developed and basically unchangeable by the time you reach late adolescence. As our ability to scan the brain and to further understand the processes of the brain and the nervous system, we now know that in fact, that belief is not correct, and that actually the human brain continues to grow and develop throughout the entire lifespan into the elderly years. And so the term neuroplasticity refers to the capacity of our brains, neurons, to be plastic. In other words, that they're changeable, they can grow, and they can make new connections. And that this can be either positive or negative. So what does this mean? What's the so what of that? Why is that important? It means that throughout the entire lifespan, people can retain the capacity to learn and grow and change things. Not just thoughts, not just behavior, but physiological processes as well. Our thoughts, our emotions, our behaviors form neural pathways that either help or hinder our happiness and health. When you've established early on in your life a pattern of exercise that you enjoy and feel good doing, we would call that positive neuroplasticity. In the same way, if you've come to learn that anxiety or depression are going to limit you and that you're not able to do things and not able to function, that's a kind of negative neuroplasticity. We mention neuroplasticity because it's a hopeful message for us. It's the hopeful message to realize that we can change, that our neural pathways can change, and that clinical hypnosis is one very powerful tool to help that process along. I think I forget exactly who to attribute this to, but the phrase neurons that fire together, wire together. This can happen in a negative sense if someone has negative beliefs or longstanding emotional patterns that are self-limiting, or have had chronic physical symptoms that have lasted for a long time. But it can also happen in a positive way as well. That when you learn new habits, new patterns, new ways of behaving and responding in response to something that feels bad, you create new positive neural connections too. Hypnosis helps us to do this. So, what is hypnosis after all?
Oh,
Go ahead, Maryanna.
yeah, this is so wonderful. So, of course, people watch TV, and there are pharmaceutical companies advertising this tablet, this medicine, that medicine. Remember the recent advertisement about medication to treat Alzheimer that has not been proven actually to be really something that will do such a thing. But so imagine if a pharmaceutical company comes out with a medication and it's very pleasant to take it. It has no bitter taste. It's not hard to swallow. You don't have to do it 3 times a day, 15 minutes before meals or 16 minutes after the meal. And it also actually makes you better. Not only it will not give side effects that are detrimental to you sometimes and need to be treated with other medication to cross those side effects, right? But it also teaches you something, makes you better as a person, makes you find something that is very special about your experiences. Doesn't have side effects, actually, again, makes you just feel better, makes you stronger. It's improving your immune system. How about that? Wouldn't that be a great medication to have? And imagine for how much it would be selling, right? But it's inexpensive. It's available. It's right there, more so. And I need to say that not only you don't need somebody necessarily to do that with you, but you can learn to do it yourself. You can practice self-hypnosis if you're being taught. And there is even a term, waking self-hypnosis, when you can get yourself in a state that you can accomplish something that seems to be very difficult to accomplish, being awake and giving yourself that task and that goal. And makes you feel accomplished, stronger. So that whole process of being treated does not leave you worse sometimes, but makes you better. No side effects. Wouldn't that be nice?
Wouldn't that be nice? So, as we've been intimating here, hypnosis can be a very, very powerful tool, helping with acute and chronic pain, sleep disturbance. For those of you who are not familiar with the literature on this, there's a profound literature about the efficacy of hypnosis for wound healing and even bone healing after fractures, helping the immune system. I know that especially during this time of COVID, I've been very happy to see some of the benefits that my patients have experienced using hypnosis to strengthen their immune system, to down-regulate fear reactions and anxiety and phobias, decreasing pain and anxiety and depression, to coordinate and regulate body systems for important tasks, for doing it for peak performance, whether that's in sports, whether that's in education. I know that our colleague, Dr. David Warwick, has written extensively in the literature about applications of hypnosis in education, and especially in the use of active alert trance, where you're actually in an alert state with your eyes open and still able to practice some of these hypnotic skills in very powerful ways to help all kinds of different performance.
Oh, I will take this one because it's just so interesting. The history of hypnosis, fascinating. Of course, we know that different cultures and different human societies practice some sort of interaction, but we never really found in literature or in any evidence in old texts that it was conscientious. It was specifically made that way to induce trance and do some sort of therapeutic application of that. It was part of rituals frequently, or just what people did. Really it came into known in end of 18th century with the physician called Franz Mesmer, for good reason and not so good reason. He was a physician that was very interesting at that time, very popular with all sorts of ideas about fluid exchange, energy exchange. People were excited about electricity, magnetism. So he decided the magnet is something that really can affect, a physician can, through the magnet, can affect the cure in somebody else. So he was doing it for a while, became really, really popular. And then, of course, there was a scientific committee that was led by Thomas Jefferson. And they did all sorts of studies that showed, magnets have nothing to do with anything. And because of that, the conclusion of the committee was, doesn't mean anything. However, what I found researching this is that there was a different conclusion that was not widespread that much. And that conclusion was that there were actually true cures, that something was happening, that people were getting better. And so there was no really look into what was happening there. And the therapeutic suggestion was forgotten or kind of covered up by all sorts of other things that were going on. And of course, there were a lot of true healers. There were true scientists that were participating in that. But really has not become that developed until the end of 19th century, where in England and France, there was a lot of research being done. And at the same time, because the medicine was really, in the beginning, I'd say, doctors still didn't use antiseptics at that time. Imagine that. There was no anesthesia. So one of the physicians from England was a surgeon in India at that time, and he was practicing hypnosis to do surgical procedures on people. Were hundreds and hundreds of people that were operated at that time. And if you can imagine the whole ordeal, how terrible those surgeries were, and the amputations and huge tumors, all that. And suddenly he was able to do it all without pain and suffering. It was quite amazing. Of course, when people found a faster way to do it and with anesthetics, it fell out of favor that much. However, I need to say that a lot of dentists and physicians are learning hypnosis in Europe. Dentists commonly use hypnosis when they do dental procedures, much less than in Americas. I also want to say about not only medicine, but also what else hypnosis has done. If you love classical music, you probably heard Rachmaninoff's Second Concerto, Piano Concerto. It is one of my favorites, and I'm sure a lot of people love it. So Rachmaninoff was a very young composer at that time, and he created Concerto No. 1. And of course it failed. Well, of course, at that time seemed like, of course, it's still great music. After that, he fell into severe, deep depression. He wouldn't leave the room. He was on the couch all day long. He was thinking about hurting himself and felt that life is not worth living because he cannot write good music. His very educated family wanted to help him, so they found a hypnotist who was practicing at that time in Russia, and he was coming frequently to Rachmaninoff and conducting hypnosis session. And from what I read, one of the suggestions was the next thing that you're going to write, the next piece of music you're going to write is going to be one of the most beautiful musical things ever written. And after a while, it took about a year, but came out the Concerto No. 2. And so how many physicians, how many doctors, practicing doctors can say that a great piece of music, a great piece of art was dedicated to them? Now imagine, actually the second piano concerto of Rachmaninoff is dedicated to the hypnotist whose name was Nikolai Dahl. Isn't that something? Quite amazing. And I have to say that a lot of literature, people in literature and music were very interested in that. Dickens learned that. It was actually also used by a hypnotist that was working. I'm sure you remember the movie The King's Speech. And actually that was a hypnotist who was working with the King, George VI. And the same hypnotist was working with a famous writer, Somerset Maugham. So all those very interesting things from the history, something to learn about and change someone's trajectory of their life. And I hope from what you learned today will make you interested in learning more, looking into the very rich history of hypnosis, and disregard a lot of things that were happening as not necessarily people just didn't know better yet at that time.
Right. And Rachmaninoff's one of my personal favorites too. It's exciting to think about not only what hypnosis has inspired in terms of people's greatness and bypassing barriers, but what you can do for your patients in that regard as well. So with that background, let's move ahead to talk about what exactly hypnosis is. There's interesting controversies and differences of opinion in the professional fields about this. I like to introduce hypnosis to my patients, or when I'm talking to others. It's really about utilizing normal everyday phenomena that we experience, you experience all the time. For example, imagine that you're on your way to catch a plane and you're late and you're running to get to the gate and you're looking at your watch and you're running and you finally get on the plane and you realize once you sit down and catch your breath that you got a pebble in the bottom of your shoe that hurts a little bit, but you didn't notice it. That's dissociation, a normally occurring hypnotic phenomena. Or you're on your vacation and you're having a wonderful time and it feels like time just passes like that. Time passes way more quickly. That's time distortion, a normally occurring hypnotic phenomena. Or you're sitting in a really boring lecture and feels like time's taking forever. Again, time distortion, normally occurring hypnotic phenomena. Or think of the situation where a little child's playing in their front yard and they fall and they skin their knee and nobody else is there and they're kind of trying to hold it together and you see their lips kind of trembling. And then mom or dad comes out and picks up the child and holds them and kisses the owie. And what happens? It's all better. Altered perception, a normally occurring hypnotic phenomena that we experience and witness all the time. So really, you can think of clinical hypnosis in a less technical way, is that we're really utilizing these normally occurring hypnotic phenomena for the clinical goal of bringing comfort and reducing suffering. That's really what hypnosis is. For many people, one of the big concerns they have about hypnosis, whether you're a consumer and wondering whether to avail yourself of hypnosis treatment, or whether you're a clinician, is the concerns that hypnosis was this kind of shady treatment where, you know, half the people when you first bring up the word hypnosis, oh, you can make me bark like a dog, because they associate hypnosis with stage hypnosis, unfortunately. But nothing could be further from the truth. Stage hypnosis is unfortunate because since many people view this as an entertainment thing and kind of goofy, they don't consider it when they're in distress. And yet hypnosis, when utilized by a licensed health professional, is a safe and powerful tool for all kinds of healing.
I would like to add to this for a second is that we're talking about suggestion, absorption, dissociation. One of the reasons Mark and I are doing this today is that to bring awareness to those in the audience who are medical professionals and remind them that sometimes when a person is in great need, they're so absorbed in their need, in their suffering, and their pain, that everything that is being said becomes very important to them. So it's not the hypnosis session, but the person might be in a hypnotic state. And so any suggestion that is negative will be accepted just because they're in that state of mind where they scanning the environment, looking for something that is very important to them, and they will take the negative suggestion. So a suggestion of, it's going to be really, really bad. It's going to hurt a lot. You don't know yet what's going to be happening. You know that it might be some discomfort, right? But when you say suggesting negative experiences and not knowing what state the person is, and they might be in a hypnotic state, those negative suggestions will be accepted. So mindful about what we say, how we say it. And it's not necessarily in medicine. It could be a friend. It could be just somebody that passing by that, our words might bring a negative association with them because we just don't know what states people are.
Maryanna, you're reminding me that one of the many compelling reasons for professionals to learn more about hypnosis is precisely this point, that the more that you study and learn about what happens in the doctor-patient interaction, you recognize that hypnosis is already taking place, that suggestions are being made, and that the patient is absorbing and perceiving things sometimes with a great level of suggestibility. And so it really behooves us to know what is the impact of our words so that we can use those suggestions wisely. I saw this great cartoon recently. It shows a patient sitting on an exam table, and a nurse was standing there and said, what you'll often hear someone say before an injection, which is, you'll feel a pinch and then a burn. And in one hand, she had a crab with these big pincers, and the other hand, she had a blowtorch. But that's funny because emotionally, we perceive the words that way. And imagine how different the experience would be if the clinician about to give an injection says, when you first feel the sensation of this, that'll be the signal that the healing process is already beginning. Imagine what a different set of perceptions and associations will go along with that to help the healing process. So going on further about what is hypnosis, it's basically a procedure in which the clinician suggests changes in perceptions, thoughts, behavior, or sensation. We know that in general, there is a heightened focus on inner experience and a shutting out of external distractions. Most people who have experienced hypnosis describe it as a state of focused awareness in which most of the time they feel very calm and relaxed. Not always, but more often. And most, but not all, hypnosis includes suggestions for relaxation, calmness, and well-being. The more you know about the central nervous system and the autonomic nervous system that we'll discuss in a little while, the more you can understand how vastly useful these types of suggestions can be. So many of you may not realize that hypnosis has a profound empirical research basis to it. It's been studied in great detail in many institutions. And so we know now with a fair degree of certainty, with empirical, well-designed studies, that hypnosis can be used to treat a number of different conditions. And what you see listed here are just some of them. Really, what I found consulting in hospitals and clinics is that hypnosis, there really isn't any area I found where hypnosis is not helpful through all these different areas and can address several different types of problems all at once. So its potential is very exciting.
At the same time, you see sometimes people very excited about what they think it's alternative, so they want to try something that is different from medicine. And it is said sometimes that we are not very good explaining that there is not that medicine and this medicine. There is one medicine, really, and there are just different tools. And you use the tools that are right. You're not going to use hypnosis for treatment of acute cholecystitis. You just need to have this thing removed, period. And so many other things, it's not the cure for a fracture. However, the experience that the person is going through, if they have a fracture, could be easier. And instead of bringing more pain and suffering and delayed healing and side effects from pain medication, it can make the experience so much faster, so much easier. And so it doesn't become a centerpiece of someone's life. What I like to tell my patients is that, I don't want you to be a patient. I don't want you to be somebody who is thinking of themselves as a patient. You're just a person who happens to have this, this, and this. Bringing that, the personality, their life, their experiences, the purpose, the goals, the desires, their curiosities, the loves, their hates, whatever is they live their life. This is what's important. And then being a patient is just secondary. And when you do that, you see that it really, you can be very happy having a serious medical condition, have fulfilling life. And at the same time, you could be really taken up by a regular thing. And so bringing that humanity in a person and looking at all these problems as something that, yeah, you're just getting help. You're just getting something, a tool that helps you to achieve what is it that you want to achieve. So creating a goal, when we're discussing a plan with a patient or a client and for a therapist, psychologist case, it is very important to create what is the goal? What do you want to achieve? Is it realistic? Is it rational? It's okay. Sometimes we're not very realistic and not very rational. We correct it. But what is the goal? And then we find, yes, if I want to play music, I will take the violin. I'm not going to take the hammer. So we're using different things to create the better result.
So another piece that we want to share with you is another reason that I think hypnosis has not been more widely used until recently, is that there's been a lot of myths and misconceptions about what hypnosis is and is not. So we want to cover some of those just briefly. I hope you haven't been looking forward to quacking like a duck, because that's not going to happen with hypnosis here or in the entertainment settings. I'm going to also point out that sometimes you'll hear the term hypnotherapy. I tend not to use that term because hypnosis is not actually a therapy. I don't think it's proper to refer someone for hypnosis therapy. I think it's better to think of hypnosis as something that makes whatever treatment you're doing work better. If you're a dentist and you use hypnosis, it's going to allow you to do the work that you do with working with TMJ and with dental phobias and fears and pain more effectively. If you're a physician working in primary care, it's going to help you more with being more effective with the everyday types of common problems that people come in with. If you're a clinical health psychologist working in a hospital setting, it's going to help you when you're dealing with the patient who has fears about therapies after a stroke, to be more effective in their coping skills and strategies to do that more effectively. So let's talk just briefly about what some of these misconceptions are. Many people think that if you respond to hypnotic suggestions, that you're gullible. When in fact, ironically, it's just the opposite. The ability to experience hypnosis is greater in people who have a creative imagination and actually can concentrate better. Despite what you might have heard, you cannot be forced or influenced in hypnosis to do or say something against your will. This is something I've seen very often right from the beginning of my hypnosis usage. Although the word itself is similar to the Latin root for sleep, in fact, hypnosis is not sleep, and it's not a state of unconsciousness. And we know from EEG studies, for example, that when someone is in the hypnotic trance state, it is a different state neurologically than that of sleep. So for you who are professionals who may be learning hypnosis, one thing you'll learn if you take something like the ASCH 20-hour course is you won't refer to the person when they're in trance as in sleep. And at the end of hypnosis, now you're going to come out of sleep because they're not sleeping. You should also know that amnesia, having amnesia for the hypnosis experience is very, very rare. And in fact, what's much more common is that people who experience hypnosis often remember all or most of the experience they've had.
The data shows that a lot of what we see on stage is a lot of that is role playing. People sign up, they go. Of course, there's the scanning, the hypnotists are scanning the audience to see who is more excited because people just want to try it. And I found in Mark Twain memoirs that he was very interested in that when he was a young person. And he was dying to get on stage and participate in the hypnotic show because it seemed like a lot of fun. And he was finally called one time and he went and he found like, okay, I don't know what to do. I don't feel anything. So he just played along, which a lot of people do.
I think another important point about stage hypnosis is despite the fact that it's ill-advised, the other bigger problem is technically it's really not that hard to get someone into a hypnotic trance state. What is much harder though is what do you do with someone once they're in trance? What types of suggestions do you use? How are you addressing what's there? And if someone is vulnerable or has some trauma history or things like that, you can do a lot of damage when you don't know what you're doing. So, but we don't want to get too much on the soapbox about stage hypnosis. I think you know our opinion about it at this point. So
You won't catch us doing it.
Right. I want you to have something with personal experience because there's parts of the brain that learn best by experience. So, for example, I want you to close your eyes for a moment. And I want you to imagine that you're walking into the kitchen in your home. You're going to open the refrigerator door. You're going to reach into the fruit and vegetable drawer and pull out a great big juicy lemon. Feel the coldness of the lemon in your hand. Close the refrigerator door, bring it over to a cutting board and pull out a knife. And then I want you to picture and imagine that you're going to slice that lemon in half. And then take that half of the lemon and hold it up to your nose. Take a big whiff of that tangy lemon aroma. Cut that half of a lemon into a quarter. Take that quarter of a lemon, and now I want you to imagine that you're going to sink your teeth right into that big, juicy, ripe lemon. Taste the tangy lemon juices swirling around your tongue and in your mouth. Now, if you're like many people, as we were doing this, a lot of people start to like get a sour look and many people are like wiping their mouth because they've been drooling, but yet there's no lemon in your mouth. So what was it that caused that involuntary change in your nervous system? It was an image. Now, let's have a different image. Close your eyes once again. Imagine that you're standing at the top of a 10-story building. You're up on the roof and you're looking down from 10 stories up, looking at the cars passing by, people walking by from 10 stories below. Imagine for just a moment, as you really focus in on that image, what your body feels like. 10 stories up, there might be a little breeze, so you might feel your body swaying back and forth a little bit up there on the 10th floor. Just feel the physiological changes and note that once again, these are physical changes that are occurring even though you are not standing on the top of a 10-story building. Now, new image. Take a deep breath, close your eyes, and I want you to imagine picturing the face of somebody you love. Picture the face very closely of someone that you love. And just feel that smile that starts to come across your face almost uncontrollably. Notice the feeling of warmth that starts to spread through your body. Got that? So open your eyes again. So this begs the question, you just had experiences where an image created a full body experience as if you were there. What's happening physiologically that's causing this? I think this is an important question, and it helps us to understand some of the underpinnings of what happens during hypnosis.
Well, let's learn a little bit more without fear.
Yeah. So we want to demystify this a little bit more for you about what are some of the highlights of what we know about what actually happens in the brain and the nervous system during hypnosis. So if we talk on the more macro level, so what we're looking at here is an image of a brain from if you're doing a cutaway, this would be the right half of the brain. And here's the front or the anterior, here's the rear or posterior. And this is the cortex, and then the limbic brain and the brainstem. And we know that sometimes the primitive brain regions have a profound influence on the higher brain regions, the ones that affect abstract reasoning, logical thought, things like that. What's an example of this? You know how sometimes if you're driving to work and you're running late and you're in a hurry, and in front of you is someone driving in the car in front of you who's must be about 90 years old, and they're about 3 feet high, and their head basically comes up to the top of the steering wheel, and they're going 5 miles an hour. And you're running late, and what are you going to feel? Of course, you're going to be frustrated and impatient and looking at your watch and pounding on the dashboard and all these things. And yet, if by chance you had the opportunity that morning before you got in the car to go to work, to do a meditation, to do a self-hypnosis, to have the opportunity to be at the club and take a swim or be in the hot tub for a while, that your system is more relaxed. And then your thoughts about this elderly person driving in front of you aren't so critical, more accepting, more forgiving, more patient. This is where the limbic brain structures can influence the way that we think about something.
How we interpret things, because something that adrenaline rush, it feels very unpleasant. However, at the same time, we seek that adrenaline rush all the time when we go to amusement park or do something just different. That seems to be exciting. We jump in the water, we try to climb the mountain, and exactly the same thing is perceived as very pleasant.
Right, right. And the opposite is also true, which is that the higher brain regions, meaning the cerebral cortex, and particularly the left temporofrontal cortex, which controls rational logical thought, can modulate and inhibit the more primitive regions of the subcortical brain. Subcortical being what I'm circling here. What's an example of that? A number of years ago, I was flying from Minneapolis to Hilton Head, South Carolina, to teach at a conference. Actually, it's called The Psychology of Health, Immunity, and Disease. Maybe some of you might have been at that conference. And we were heading southeast from Minneapolis down toward Chicago, and then down to the southeast towards South Carolina. When we got about an hour into the flight, the captain gets on and says, ladies and gentlemen, this is the captain. We're cruising at 31,000 feet. I want to alert you that in about 20 minutes, when we get over the Chicago metropolitan area, we are going to be experiencing severe turbulence. I repeat, severe turbulence in 20 minutes. So, you know, I'm not too bad of a flyer, but when I hear the captain go, severe turbulence in 20 minutes, that kind of gets me going a little bit. My hands got a little sweaty. I started to get nervous and tense. And I thought, wait a minute, I teach mind-body medicine. You would think maybe I know something to do about this. So having remembered that, having a cognitive thought process of, oh, I think there's something I can do about that. I started doing some controlled breathing. I did a little bit of imagery to calm myself. And that ended up calming the areas of my limbic system that were signaling a threat. And I was a lot more comfortable. So we're learning more about how these different brain regions communicate with one another. And hypnosis facilitates this process. So this is a good title for a book, I think. What's the limbic system and why should you care?
Yes, that's how we care.
Right. So first of all, what is it? The limbic system is actually a group, it's an area, it's a group of structures in the brain under the cortex that includes, but not limited to, the amygdala, the hypothalamus, and the hippocampus. You might have heard some of these structures before. The term limbic literally means border. It's the border between the so-called higher functions of the cognitive cerebral cortex and the lower brain structures of the limbic brain and brainstem that control emotions and physiological responses. Those who have studied mind-body medicine have contributed some wonderful research that tells us that the area of the limbic brain mediates emotional experience, emotional behavior, and this is where something very important happens. Emotions and behavioral impulses in the cortex are sent downward through the limbic brain and they're converted. They're converted to hormones, hormonal messenger molecules. It comes in the form of neurotransmitters, hormones that communicate with different parts of the body, and immune messenger molecules known as cytokines, which is how we now know that our hormonal state, the state of our immune function is very much affected by our thoughts and our emotions. You can think of the limbic brain as the part of the brain that's saying, yes, this is true, you can believe it. So one of the reasons why, for example, when someone's having a panic attack, the least helpful thing that you can say to them is what? It's relax, right? Because they're already trying to relax and they can't do it. And why does that not work? Because while the rational brain's saying relax, the limbic brain's saying, hey, guess what? I have a louder voice than you do at times like this. And I'm saying we're in crisis. So guess what? We're in crisis. So why is this important? It's important because something very important in any kind of healing endeavor is we have to learn to speak to this part of the brain. We have to learn to communicate with the limbic brain. Just so happens that hypnosis is one of the most effective and powerful ways to do that.
It is also very interesting that a lot of neurotransmitters in the brain, in the limbic area, also doing a lot of other things, functions in the body, with the cardiovascular system, with the GI system. That's why when we experience strong emotions, we tend to describe them in the physical terms. For example, I felt bad news, or you're disappointed, you felt punched in the gut, right? Or your heart is squeezed. Or if it's a happy experience, I feel like flying, something that is, you feel light, like your heart is light, your heart is singing. So the body is using, that's why there is very helpful to use hypnosis in psychosomatic conditions where there is that connection between the limbic system, the brain, and also the organs that are doing everything else in our body.
Maryanna, that's so true. And I'm thinking that instinctively, most people know this. Instinctively,
Okay.
people know about this connection. I'm thinking actually there's in my other life, I'm a jazz musician and I love Stevie Wonder. And the lyrics to one of his songs, there's a line where he says, I don't want to have an upset stomach from a broken heart. So people, we get this. It's just we don't logically associate it, but I think this is very important.
But you know what's interesting too? I mean, it's not a scientific at all. It's just my observation that different people seem to be having predisposition to different. So one person will describe everything in the gut feeling. My gut tells me I was punched in the gut, or my stomach was turning. So a lot of the conversation when they want to discuss their strong feelings or important things happening in their life, there'll be a lot of that. And somebody is going to be talking about the heart. I felt it in my heart, and my heart was squeezed. Or I, I find it very interesting because it is consistent.
Yes. And what's really interesting, I think there's a common belief out there that emotions are something that happen in your head. When in fact, as Maryanna was saying, the only way that you can experience emotions is in the body. There is no other way to experience it. Even when you're filled with worries, there is a somatic component to that. And again, part of the power of hypnosis is being able to communicate on all those levels concurrently and simultaneously. By the way, George, I want to just touch base. Do we have any questions from the audience as of yet?
He wants to keep them secret for now.
Yeah.
Okay. No,
I hope
we had
landscape.
one question. Let's see. It is from Juliana, and she said, "This is very helpful. As a mental health therapist, would love recommendations to learn hypnosis. Thank you." So I figure later on you were going to get to that.
Okay.
But
Yeah.
whatever.
Yes, absolutely. And by the way, just a comment about that. We're going to recommend for any health professionals who are tuning in this evening to this to become a member of ASCH and to benefit from being part of this wonderful community of clinicians who are ASCH members. And one thing that you'll learn if you work in the mind-body medicine field is that if you were trained in what was more traditionally a physical discipline, dentistry or medicine, or if you're trained in what was more originally a psychologically oriented discipline, like being a clinical psychologist, that to work in mind-body medicine, you really have to cross-train. And what's really wonderful about the membership of ASCH is that I find it to be a group that for the most part are great and interested in doing that cross-training. Learning, getting up to speed on physiology as well as about psychodynamics and personality and different types of psychotherapies. I think all of us need to be cross-trained to work in this area. And part of what's so exciting about ASCH is that most of the membership actually does. So I think that's very exciting. And one of the reasons that I've remained a member for a very long time.
I was thinking more about what you were just saying, and I teach students in Quinnipiac Medical School and medical school, UConn Medical School, and they come very, very young, first year medical students, and I try to make a point. I don't know if I'm successful always. I hope so. To say that there is really no separate thing, body, mind, medicine. We all practice it. Unfortunately, a lot of us don't know it. They're still practicing, they just don't know it.
Yeah.
And so that creates occasional, don't want to say scary, but miscommunications, unnecessary pain and suffering, unnecessary things that could be avoided if everybody was aware this is what we're doing. However you call it, the coldest surgeon who doesn't talk to the patient, he still, or she is still practicing body-mind medicine. They just practice it in a way that is not very necessarily most productive.
Right.
So it's not about is it good or bad, it's just we don't know. So the educational part of that whatever, if you practice medicine in any way, form, or shape, or mental health in any way, form, or shape, all of us practice body-mind medicine and psychology and so on.
Right. And so it behooves us to know the terrain that we're working in and to know the impact of actions that we're taking. And for those of you who are coming more from a strictly mental health discipline, your words, your actions, your observations, your expressions are also creating physiological reactions. And it behooves us to understand what those reactions are, not only to know about them, to be able to recognize them in our individual patient, to be able to have helpful impact. And I think that the training that you get in hypnosis really primes you to be looking for those kinds of cues, even if you think of yourself as doing traditional psychotherapy. I think those kinds of cues are always happening. and can
You,
really empower you to help relieve suffering.
so
That-
Mark, you're saying that, say, if the patient or client comes, they see you and their face looks like exactly after that lemon exercise, that's not the good thing?
There you go. Exactly. And so one of the things I really appreciate about hypnosis is you learn to be a better and better observer. You learn to notice more and more minute and subtle reactions in your patients and clients in ways that's just very, very helpful. I want to make sure we've got time for some questions at the end. So I'm going to move ahead a little bit. The meaning here just of this slide is for any of you, regardless of your professional orientation, hopefully know about the autonomic nervous system and about the sympathetic and parasympathetic branches. Suffice to say for right now, we know that in many chronic illnesses, and especially in chronic pain, there is dysregulation between the activating sympathetic and the calming parasympathetic branch. And of all the treatments out there, hypnosis is one of the most effective at being able to optimize the balance between the two branches of this very important nervous system. One of the many reasons why it's important to know about this. I want to say something just briefly about that one structure in the limbic brain called the amygdala. The amygdala is the structure in your brain that is particularly responsible for setting off the threat network. It's the part that's constantly scanning for threat. And when it perceives a threat, it sets off the alarms. Those alarms can be what we think of in part as the fight-flight response. You know, your heart races, muscles get tight, your vision becomes hypervigilant, and you're getting ready to fight or flee. So think of the amygdala, for example, like a security guard working in a building, looking at all these TV monitors, and if somebody breaks in, it's going to set the alarms off. But imagine if someone plays a joke on the security guard, like they did in the movie Ocean's 11, if any of you saw that movie, where they did this elaborate thing where these robbers filmed breaking into a vault as if they had actually done it. And they played it on the TV monitors so that the guys at the Bellagio Casino in Las Vegas looked at the screens and they thought that someone's breaking into their vault, and they set off all this hubbub and chaos, and they were able to steal the money. The point is that the amygdala has a loose grip on reality. Think about that for a second. How else can we get scared at a scary movie? You know, when you're sitting in a movie and Jack Nicholson in The Shining is standing behind the door with the knife and he's waiting to pounce, you know he's not going to leap off the screen and run over to you in the theater and start stabbing. But it feels as if that's exactly what's going to happen, right? Our palms get sweaty. We're on the edge of our seat.
He
What
is
is
so
it?
particularly scary, though, I have to say.
Well, but it's for different people, different things are scary. But the point being, there's parts of our brain, such as the amygdala, that don't know the difference between a real threat and a perceived threat and set off the same physiological response. Think about, for example, civil defense sirens. Like I know in Minneapolis, the first Wednesday of the month, 1 o'clock, civil defense sirens go off. So if I'm with a patient and I say to them, when it's Wednesday, first Wednesday of the month, 1 o'clock, you hear the sirens, do you get scared? They say, no. Why not? Well, it's just, you know, they're testing the sirens first Wednesday of the month. I said, right. Now, imagine you hear the exact same sound 3 a.m. on a Sunday morning. Would you feel differently? Oh yeah, I'd jump out of bed and I'd turn on the TV or the computer and see what the hell is going on. The difference between the first scenario and the second scenario is the amygdala. The amygdala assigning a different threat value to incoming stimulus. Why is this important? It's important because using hypnosis, you can actually learn how to talk to brain structures like the amygdala and portray a different scenario, a scenario that's more healing, less threatening, more productive, having more options for choice. So this is something that we know about the physiology of what we're talking to in the brain when we use hypnosis.
I have to add that adding why is it that we use breathing exercises or, relaxing breathing or deep breathing when we help people get into a trance state, because it does stimulate parasympathetic nervous system, the receptors in the diaphragm, and that way creates a faster transition into a more quiet and comfortable state. So whatever it is that will help the stimulate parasympathetic nervous system would help that. So breathing is the one, but there are other things like a lobe massage, for example, gurgling sounds or chanting. Those are the things that help person to practice getting. So you can practice getting into that state of mind, not necessarily even doing hypnosis, but it helps.
Absolutely. And keep in mind too, that if you're working in a psychotherapy setting, rather than in more of a physical health setting like Maryanna and I do, and you're treating patients for depression, anxiety, phobias, PTSD, we've got these same phenomena going on. With someone with PTSD, you have an amygdala that's highly activated and assigning threat to many, many things going on because of the trauma that the person's been through. Among the other treatments that you use, using hypnosis to learn to speak to the limbic brain with messages of reassurance, messages of safety, messages of containment, messages of agency. It's profound what can be done to help alleviate some of the suffering with these kinds of conditions. So, geez, if there was only a way to communicate with these parts of the brain, I don't know, Maryanna, can you think of any way to communicate to those parts of the brain?
Just screaming loudly, is that?
Maybe I'm just not talking loudly enough. Maybe that's it. I don't want to get too deep in the weeds here, but just in general, for those of you who are a little bit more interested in the details of what's happening in the brain, we know that in general, if you think of the left temporofrontal, so if you're looking at me, it's this the left front part of the brain, temporofrontal meaning between the frontal lobe and the temporal lobe. There's a quieting of that part of the brain that's doing more rational analytical thinking, and a heightened receptivity to suggestions in the right cortex and our friend, the limbic brain that we were just talking about. I'm going to kind of pass this here because this is getting a little bit more detailed than I think what we need for the moment. But I'm just going to get to the conclusion here, which is studies that have been done recently have isolated some of the parts of the brain that are either amplified or suppressed during hypnosis. And in conclusion, what we'd say is that these changes facilitate absorption, being able to be deeply involved in the experience. It facilitates dissociation. In other words, it helps at times to be able to say, if you have pain in your arm, you can imagine that that arm is 20 feet away and you're so far away from it that you don't feel any discomfort at all. And thirdly, it facilitates parts of the brain that allows us to have conscious input into changing what we experience in our body. So to be able to say, right now, you can take that slider or that knob and turn it down to the point where you don't feel that same headache in your forehead. You can turn that stabbing, awful pain at a 9 out of 10 down to a mild ache at a 3 out of 10. We know that what happens with hypnotic suggestions allows those parts of the brain to translate and convey that message. Maryanna, did you want to add something about that?
Yes, because I've done that so many times, and the most even people who you would never think they would be agreeing to hypnosis, but they're in a great need and they need help, they will go along with the suggestions. And it has been many, many times that I would prevent somebody going to emergency room with acute headache or something else just after taking 5 minutes. And it kind of sounds, how do you do it in the middle of a busy day? How do you do, hypnosis has to be quiet. Nobody should be there. You should be sitting and doing maybe hand waving. But in reality, in a very busy office, close the door and doesn't matter what's going on there. And you just say, would you like to try something that might be of great help to you? People go along. And then it does, and again, I know what's going on. I know what we're doing. And at the same time, you see a person opening the eyes and saying, you know, I feel better now. It feels so gratifying. It is the miracle and pleasure of it, and you just feel spectacular being a physician, being a healer. I don't want to even use that big word with that, but I think I wanted to show about how does it look from outside. You've seen that movie, Mark, called The Greatest Game Ever Played, when a young person, he's participating in the golf tournament. And it was a true story. He won the game. It was the greatest that all came. It was in 20th last century. And he's practicing and he's doing very well, but it shows a moment when he needs to do whatever he needs to do with great precision. And there are all this huge amount of people, cheering, and a lot of tension, a lot of emotions, sounds. And he looks around, he sees them all, and then suddenly he looks around and he sees nobody. It's just him perceiving every movement of the wind, noticing the grass, and doing just the right thing. I do recommend to see that. I think that will give you that sense of understanding maybe a little bit what might be happening in the brain. What is it that the person is able to accomplish?
Mm-hmm. Thank you. Yeah, that's good. Just a brief note about self-regulation. I'm aware that we have about 10 minutes left, and I want to make sure if we have time for questions. So George, if you're getting any questions, please let us know.
No new questions right now. Most of the questions are about training availability.
Okay, we'll get to that very shortly.
That's awesome.
Yeah, that's great. Very quickly, self-regulation. It's a term you may hear a lot. It's very important if you're involved in any kind of healing work, no matter what profession you're in. What is it? It's the ability to be aware of, as well as to manage your energy, your emotions, thoughts, urges, and your behavior choices in ways that help rather than hurt your health. It's an important component of how we learn to deal effectively with stress. I know whether I'm treating a patient for chronic pain, for headache, for digestive problems, preparing for a surgery, or for dealing with post-traumatic stress disorder, learning self-regulation skills is a central part of the healing process. What are examples of that? It might be self-awareness exercises. In the chronic pain field, we work a lot with teaching patients sensory awareness, awareness of sensations in the body, emotional intelligence, filtering sensory information, calming techniques, stress management techniques. Why are we talking about this? Because hypnosis is invaluable in fostering every level of self-regulation in ways that can be profoundly helpful. So let's get to training. What comes next for you? Hopefully, with what we've shared with you this evening, it's whet your appetite a little bit for the next level. If you are a health professional that want to learn more about utilizing the power of hypnosis, our recommendation is that you start with getting training from a solid professional training organization. The main ones we recommend are the—
Mark.
Yes.
It's George. Just to interrupt, it turns out we do have some questions, so I want to make sure you have time for those.
Okay. Good. So let's just get this one down. American Society of Clinical Hypnosis, who's sponsoring this presentation tonight, is a wonderful source for quality education for health professionals wanting to learn clinical hypnosis. You can get information at their website, ASCH.net. Also, the Society for Clinical and Experimental Hypnosis provides quality education in this area as well. That would be sceh.us. And you can get information there about benefits of hypnosis, what's involved in the training, and where to take next steps. If you are an individual or a consumer who's interested in seeking a qualified health professional to receive the benefits of hypnosis treatment for yourself or a loved one, again, I would recommend either going to ASCH.net or SCEH.us. ASCH.net has a provider database where you can seek a qualified health professional in your part of the country that is well trained in clinical hypnosis and qualified to provide services. So that would be where you would start in terms of finding out more about next steps. George, I'd like to hear those questions.
Okay, Jeffrey says, is suggestibility test a must for clinical hypnosis?
Let me share my thought, and then Maryanna can pipe in. I think it depends on the application. If you are doing something like a patient wants hypnosis as the only anesthesia for a surgery, I think you want to make darn sure, number one, that you have experience doing it. And number two, that's where formal suggestibility measures might be important. I think researchers find it important to measure it. I think in clinical practice, although some people will use suggestibility or hypnotizability measures, many of us have learned more informal measures of how to assess the suggestibility of a patient for hypnosis. So personally, I tend in clinical practice not to use those scales very much. One thing we also know that regardless of someone's level of suggestibility, the greater level of distress that they're in, we know that that will increase their level of suggestibility to hypnotic suggestions.
Yeah, it's time consuming and not practical really for most of the work that needs to be done in the offices. If you're doing studies, which is of course very interesting, that would be helpful. However, and also there is another truth that a lot of really, really good work is done when somebody is in a mild to moderate trance state. And that you get them to respond, because in that way, if somebody reaches very deep states of trance, the communication back and forth might be limited. So you don't really know what direction you're going to help them move. So I personally prefer to interact a lot with people, because that way I find better words and better suggestions that are acceptable to them.
So I think in conclusion about that, I think what I'd say is, I think if you're a newer clinician, I think you should know about the suggestibility studies and the scales. But in practice, you may find as you get more experience that you'll have more informal ways of assessing it.
Okay, we have a question from Maryanna. I'm new to hypnosis, but wanted to clarify what you meant by the need to be careful when someone is under hypnosis, because it could really cause damage. However, you mentioned earlier that someone under hypnosis will never take a suggestion that they don't believe in. If that is the case, how could you cause damage?
I think that comment was made in the context of talking about stage hypnosis. Where I think harm can be done is if suggestions are being made by someone who's not a trained health professional, who hasn't been trained in clinical hypnosis. I think that for a health professional who's had the background and the training, you won't do harm. And the other comment there was that it's true that you cannot get someone to do something in hypnosis that is against their values. At the same time, it really speaks to the point that if someone has a more serious access to personality disorder or a more fragile state, it's important, if you're using hypnosis with someone like that, that you're well trained in treating those conditions before you start to use hypnosis.
Hypnosis is that used in medical and mental health professions is interaction. It's not, here's the pill, go home, take it. And then if you have side effect, call me tomorrow. Doesn't work that way. It would be terribly wrong, because sensitive things come up all the time. All of us have sensitive things, old traumas, bad experiences. But that's the point of changing the perspective. The word that we use, we call reframing. So we end up discussing a lot of bad experience all the time. But the job is not to, never touch bad experience, but actually make it a learning experience, make therapeutic experience, make it something that something good grows out of bad stuff, which
Right.
happens all the time.
Right. And I think it's important to keep in mind, too, that any qualified hypnosis clinician who uses hypnosis will take time after the hypnosis to do what's called debriefing and to discuss with the patient how was the experience, what worked, what didn't work, are there concerns. So there's ample opportunity to address any concerns or difficult areas that have come up.
You have time for one more?
Yeah.
Okay.
Let's do it.
All right, let's do it. Regarding not doing anything in a hypnosis trance that goes against your morals, what about in a coercive situation with ill-intended practitioners, sleep and food deprivation? In those situations, couldn't one's vulnerabilities make one more likely to do something against character?
Would you read that again? Parts of that I wasn't quite clear about.
Okay. Regarding not doing anything in a hypnosis trance that goes against your morals, what about in a coercive situation with ill-intended practitioners, perhaps using sleep and food deprivation? In those situations, couldn't one's vulnerabilities make a person more likely to do something against their character?
I see what you're asking. It's more kind of like if you're using it in an interrogation setting or something like that. What we're talking about,
or a cult.
What?
Or a cult.
Or a cult, yes. What we're talking about is the proper and ethical use of hypnosis by licensed health professionals. That when you have the background and training, both in your professional and also in clinical hypnosis, you would not use hypnosis that way. And that's part of why being treated by a qualified health professional has had the training is important. Certainly, if it's being used in an unethical way, in a coercive way, yes, those kinds of problems are certainly possible. But
That's contrary. The story is actually the history of the hypnosis, because it is truth to be told that different countries were trying to use learn or teach how to use hypnosis, and in various countries those programs really didn't come to anything, because if you're going to beat somebody up or deprive them of food, you don't need to bother using hypnosis on top of it. But from what history is available about this, none of those programs really produced satisfactory results.
Right. Hopefully that responded to that question.
All right. Well, we are at that time. So I'm going to suggest that we begin to wrap up. And I would like to thank Dr. Weisberg and Dr. Polukhin for their time tonight and sharing their expertise with us. This has been a great presentation. As mentioned at the beginning of the webinar, this session has been recorded and will be available early next week on the ASCH website. Tomorrow, you'll receive a link to a short program evaluation. And to be eligible for ASCH CE, for those who need it, completion of the evaluation is required. We hope that you take a few minutes regardless and give us your feedback. It helps ensure that we are offering program content that makes a difference to you and your practice. This concludes our program. And so I'm sure Maryanna and Mark will have some words to say, but thanks so much for attending, everybody.
Yeah, thank you, George. And again, I want to say it's my pleasure to spend time with all of you this evening. I hope you found this informative and helpful and motivating to be more involved with hypnosis, either professionally or personally. If you have any questions for me about anything that we covered this evening or related topics, you can see on this screen here is my website, and you can send me a message and I'll be happy to respond.
And my saying is, when you the fork, take the right one, and hopefully you took the right one this time, and maybe just made one little step in the direction that when you will be looking sometime later, you'll say, well, that was the moment, just like it was for me and for Mark and for George in our careers, when that was the step that I made in that direction. I was really awesome. Good night.
Good night, everybody.
Bye-bye. Thank you.
Maryanna and Mark, let's stay on, and after everybody else goes, we'll do a short debrief. That's okay?
Yep.
And Joanna, when you get a chance, can you turn my video back on? I can't enable it.
George, I'm kind of enjoying your photo there. Can I just keep looking at that?
Sure. You want me just to leave that up? I should just leave that. I should try that with my practice.
Maybe you can just make them out and have the rest do it.
No, that
Right,
would be a
like
good,
one of those little cartoon things, you know.
yeah, that look.
That should work just fine. All right, there we go. All right, start my video. All right, now I've got to.
A couple of attendees to sign off.
Okay, unfortunately, Dave had to leave to start his, yeah, well, we still got some people on, so I'll hold. If everybody not involved in the production could go ahead and leave the webinar, thank you. Well, I think you guys did a great job.
Thanks, George.
Well, it is amazing and wonderful that it's a sellout for the training sessions. I know that will be a great problem to have if more training sessions need to be done.
I know we've got to, yeah, it's a nice problem.
What I like,
Joanna, are you on?
Yeah.
Okay.
Okay.
You want to join us? Want to join us via video?
Sure.
You can use my picture if you want. Mark seems to like that. So.
Actually, Mark, if you want to stop sharing, that'd be great.
Mark, if you can stop sharing.
Oh,
it was great that people stayed on, so they didn't like fall off.
There you go.
They didn't fall off there.
Yeah, we had
The grid.
68 participants at height, which is pretty good.
No, it was very nice. A great job. Joanna, I take it everything went well on your end. It seemed like it went smoothly.
Yep.
Yeah.
That was awesome.
Nice job.
Mark, thank you for guiding.
oh, Maryanna, it was fun to do it with you.
Awesome.
No, and we very much appreciate all the time and effort you put into this. So thank you so much.
Okay, and what Mark's going to get about what, $10,000? I think that's it.
Yeah, that's what I was told.
Oh, what am I thinking? Jeez.
Your stipend is on its way.
That's for the first 30 minutes. I'm wondering about after that.
Oh, I see. Okay. Head for the hills. All right.
I will do. Typically, we ask for evaluations to be completed within 7 days. So tomorrow, an email will go out to everyone who attended. And it'll have a link to a very short program evaluation. And again, it'll give them a deadline date for completing it. And also, if they do want ASCH CE, it'll require them to identify themselves on the survey. So we will, once the survey is closed, pull the results together, do a summary, and share definitely with the task force, but also Mark with you as well, a copy of that summary.
Great.
Mm-hmm. Honestly, I was thinking right now about, like a mini introduction to hypnosis for professionals, not as basic training, but a little bit more in depth without practicing necessarily, but taking it to a higher professional level that Mark started with. But of course, we don't know who's there. So
right, exactly.
If it's just, but for doctors, for psychologists, that might be very interesting stuff.
Yeah.
So yeah,
That
we'll
was-
have to
that
return
was one
to
of
it.
the challenges here. I think we did okay with it, but it's speaking to two different audiences
Right.
and finding kind of the plumb line that works through both of those. So
Right, and not knowing who was in what side.
yeah,
But yeah,
Right.
but I think it went very smoothly, very helpful information,
good.
Like channeling
presented very
everybody,
nicely.
channeling everybody who cannot sign up, but at least for 1 or 2 lectures that would be, could be sold, and just taking, next step into that, so they don't get excited and then like, now what? Well, that's where you go. All right.
Okay,
Okay. Thank you so much. That was awesome. Thank you, Mark.
Thank
Good
you.
What a
and
pleasure.
Thanks to all of you.
Joanna.
Right.
Thanks, guys.
Bye,
Have a good
guys.
night.
Bye.
Okay.
Good night.
All right, good night.
Bye-bye.
Bye-bye.